Minimally invasive surgery can be applied to colon operations as well. There are certain conditions where the colon may need to be removed in part. Some of those conditions include diverticulitis, large polyps, sometimes in circumstances of cancer. The colon can be approached much in the same way, meaning a high-definition camera is inserted into the abdomen. Additional ports, additional incisions are made for specialized instruments. In this circumstance, the specialized instruments include devices that allow us to divide attachments of the colon, the blood vessels to the colon, in a very bloodless way. They allow us to remove a portion of the colon and then reconnect the two ends using staplers that provide a very safe connection, a very reliable connection. What this means for the patient is that after an operation done in this manner, typical hospitalization can be 2 or 3 days less than if they had undergone the same operation in an open fashion. More than that, patients have a return to bowel function that's much quicker. The smaller incision is much less prone to experiencing wound complications, both in the short term and the long term. Meaning, if we have to have an incision this long to remove the colon in a minimally invasive approach versus an incision 6 inches long for an open approach, well, there's less problems with wound infections, and in the long term, if the wound is to weaken, it could develop hernias in the traditional approach, which is just not as common with the tinier incision. I'm Carla Girani. I'm a general surgeon at Shawnee Mission Medical Center.